Remember, variants are in circulation, and some variants are declared as variants of concern. And this variant, you're quite right, the one that you've just mentioned from India specifically, is thought to resemble some aspects of variants that are highly transmissible, as well as avoiding immune evasion. So that is of concern. But remember, we've just come out of a second wave with a variant that exactly had those particular types of principles. Again, our approach should be the same. We should try and monitor. So in this particular case, I'm sure that the sequencing will be done and the data released for us to know. But what will then really be critical at this particular time is that that person is in isolation or quarantined, in isolation. But it's really important that the contacts of that particular individual are investigated in terms of levels of contact and exposure in order for us to test and to isolate, to really try and limit transmission. So again, you've got very good examples of that in the UK. If you remember, there was great concern about traveling from South Africa to the UK. And so they did have restrictions, but yet that virus is in circulation in the UK. In fact, it's in circulation in several other countries. So you can't really always control the importation of variants. It's going to be really difficult. But what you can do if they are identified is having a system of monitoring to ensure that you can have a tracing of what the variants are and actually be able to try and limit transmission by actually having a good trace and isolation and quarantine process in place.